Hi, my name is Lola Ogunyemi, and I'm Director of the Center for Biomedical Informatics at Charles R. Drew University of Medicine and Science in Los Angeles. And I'll be talking about using machine learning to identify a medical condition. So a little bit about me. I was born in a city called Ibadan in Nigeria and moved to the US when I was 16. I went to high school at Amherst Regional High in Amherst, Massachusetts. And in the 11th grade, I took a computer programming course and fell in love with coding. And this made me decide to major in computer science in college. So I got my bachelor's degree from Barnard College in New York, and I majored in computer science and liked it so much that I went on to graduate school also for computer science. But while I was in graduate school at the University of Pennsylvania in Philadelphia, the computer science department had a trauma surgeon and a radiologist on the faculty. And it got me really curious. I was like, why are medical doctors in the computer science department? So I started attending some of their research meetings. And that's how I discovered the discipline called biomedical informatics. Basically, ways to use computing and computer methods to help patients, to help doctors, to help nurses and other healthcare providers improve health. So I now work at Charles Drew University of Medicine and Science in Los Angeles. And my university trains healthcare professionals. We train doctors, nurses, physician assistants, and other healthcare professionals. And I run the Center for Biomedical Informatics there, which was established in 2007 to create biomedical informatics solutions for people who don't have adequate access to healthcare services. And these solutions sometimes include using artificial intelligence and machine learning to help solve problems. So in this talk, I'm going to talk about a biomedical informatics project that we used machine learning for. And what we were doing was identifying people who have diabetes, who may have a condition called diabetic retinopathy. Now, diabetic retinopathy affects the eyes, the retina, which is in the back of the eyes. And unfortunately, in the US, it's the leading cause of blindness in people between the ages of 20 and 74. If diabetic retinopathy is diagnosed early, a doctor can treat it with laser surgery or other methods, and nobody has to go blind. Unfortunately, one of the problems with diabetic retinopathy is that most people who have it don't know that anything is wrong because they don't have any symptoms. And so one of the things that machine learning can do is help to identify people who are at risk for diabetic retinopathy so that they see a doctor on time to get it treated. So I've used the term machine learning a couple of times, and I'm going to explain what it is. And first, I'll start with artificial intelligence, or AI. So AI is a way to get computers to do things that usually require the sophistication and intelligence of a real person. And getting a computer, teaching it how to do things in a way that's as sophisticated as a human being. And AI needs a lot of data to learn how to do things as well as, or in some cases, even better than a human being can. And what AI does is it uses computer algorithms or sets of instructions to process this data in order to find patterns or to make predictions. And what an algorithm is a step-by-step set of instructions for doing something. So if you've ever followed a cooking recipe, if you've ever followed a recipe to make a peanut butter sandwich, you've used an algorithm. It's a step-by-step procedure for doing something. So a recipe for making a peanut butter and jelly sandwich is a step-by-step set of instructions that tell you what to do with the bread, slices, the peanut butter, and the jelly, how to put them together in order to end up with a sandwich. So machine learning is a form of artificial intelligence, and I'm going to talk about a particular kind of machine learning called supervised machine learning, which is what we used for our diabetic retinopathy project. So with supervised machine learning, what we want to do is teach a computer how to recognize things by guiding the computer. So for example, we could teach a computer how to recognize cats and dogs from lots of pictures of cats and dogs. So we would show the computer many pictures of cats and let it know these are cats. And we would show the computer many pictures of dogs and let it know, okay, these are dogs. And what the computer would try to do is try to find patterns that make a cat different from a dog. For example, the computer could learn that Cats have whiskers and dogs don't, and that's one of the differences. We then test the computer to see how well it learned by showing it a picture of a cat or a dog that it hasn't seen before. And then we ask it to say, is this a dog or is this a cat? If the computer makes a mistake, for example, if it calls a dog a cat or it calls a cat a dog, we basically tell it the right answer so that it learns from it and it doesn't make that mistake again. And as time passes on, the computer gets better and better at recognizing cats and dogs because it keeps learning from the pictures and the feedback that it's getting. So the problem that we were trying to address was people in South Los Angeles who had diabetes and needed to get their eyes checked every year for diabetic retinopathy, but they didn't always have the opportunity to see a specialist in person. And what diabetic retinopathy is, as I've mentioned before, but I'll go over it again, is damage to blood vessels of the retina, which is in the back of the eye, caused by too much blood glucose, high blood sugar. And left untreated, as we've said before, it can lead to blindness, but it's treatable when detected early. And it's a leading cause of blindness in US adults between the ages of 20 and 74. And on the left, the pictures below, you can see a normal retina on the left. And on the right, you see what's called proliferative retinopathy. And that is what happens when fragile new blood vessels grow in the back of the retina, and they can burst and bleed at any time. And when they burst and bleed, that's what causes blindness. And once that happens, you can't reverse it. So we really want to, it's something we want to catch ahead of time. Now, one solution that my center tried was using what's called telehealth. So when a person with diabetes sees their primary care doctor, they also get a picture of the back of their eye taken, a picture of their retina using a special camera. And then a specialist, an optometrist or an ophthalmologist can look at that picture and from that picture, say whether or not the person has diabetic retinopathy. So that's one possibility, and we tried that. So why would we still use machine learning if we have that as an option? Well, not everyone at the clinics where we tried that who should get their picture taken waited to get their picture taken. So we still ended up with a lot of people who had diabetes and who might have diabetic retinopathy, but no retinal picture with which to confirm whether or not they had diabetic retinopathy. So we've thought about it for a bit, and we knew from reading lots of research, medical research, that diabetic retinopathy is affected by a number of things. One of those things is how long a patient has had diabetes. So the longer you've had diabetes, the more likely you are to get diabetic retinopathy. Having high blood sugar makes you more likely. Having insulin treatment for type 2 diabetes makes you more likely. High blood pressure, high cholesterol, diabetic kidney disease, being obese, and unfortunately, African-American or Latinx ethnicity is also associated with a higher risk of getting diabetic retinopathy. And all these things that I mentioned are called risk factors. So why do we use machine learning? Many of the risk factors that affect whether a patient has diabetic retinopathy are collected in a hospital or a clinic's electronic health record. And using machine learning, we can teach a computer to learn patterns from risk factors of people with diabetes who have diabetic retinopathy and risk factors of people with diabetes who do not have diabetic retinopathy. So the same way we taught the computer to differentiate between dogs and cats, we can teach the computer to differentiate between people who have diabetic retinopathy and those who don't. So when we have a new patient and we have no retinal picture, we can ask the computer to look at their risk factors when we've trained the computer and tell us whether this new patient has diabetic retinopathy or whether they don't. So how did we use machine learning? We got risk factors from 40,631 people who have diabetes from Los Angeles County. We knew who of these people had diabetic retinopathy and who didn't. And then we used 5 different machine learning methods to teach the computer how to recognize diabetic retinopathy. And we picked different methods because different machine learning methods have different strengths and weaknesses. And so we wanted to test different methods to find out which would be best for the data that we had. So we checked how many times each method got things right, correctly said somebody had diabetic retinopathy when they did, and correctly said they didn't have diabetic retinopathy when they didn't. We also checked, how many times each method got things wrong. And then to test further to see whether the machine learning methods were able to go from the specific 40,000 cases that they learned and were tested on to new cases, we got risk factors from 9,300 new people with diabetes, also from Los Angeles. Again, we knew who had diabetic retinopathy and who didn't. And we checked again how many times each method got things right and how many times it got things wrong. And then we picked the best machine learning method, the one that was best at identifying diabetic retinopathy. So we then worked with a healthcare system in Los Angeles that had 31,072 diabetes patients who had not had their eyes checked. So they needed to get their eyes checked. And we used the best machine learning method to find out which of these people might have diabetic retinopathy and not know it. So it told us that 7,500 of the 31,000 people might have diabetic retinopathy, so a little over a quarter of the people. And so what we did was we reached out to these people, we called them to come to the hospital to get their eyes checked. So that's one way to use machine learning. We also built a website based on the best machine learning method that doctors could use to check their patients' diabetic retinopathy risk. And we call this tool based on the machine learning, the best machine learning method, the DR risk tool. And the website looks a little like this. And this is what the tool looks like. So on the left, the bottom left, you have risk factors. So you put in somebody's age, how long they've had diabetes, and other information. And it tells you whether the patient has a low, moderate, or high risk of having diabetic retinopathy. And that can be useful to a doctor who knows the patient needs to come in, to follow up with the patient, to come in and get their eyes checked so that if they have diabetic retinopathy, they can be treated and not lose their vision. So I just wanted to say that some of the work presented was funded by the National Library of Medicine. My contact info, my email address is lola.ogunyemi@cdru.edu. And I also have the website for the DR risk tool that I presented. Thank you so much for watching this. This was made possible by the AIM Ahead project and George Washington School of Medicine and Health Sciences.